You have cancer. Miss Baring, you have advanced metastatic ovarian cancer.
Go on.
You are a professor, Miss Baring.
Like yourself, Dr. Kalikian.
Oh, yes. Now then, you present with a growth that unfortunately went undetected in stages 1, 2, and 3. Now it is an insidious adenocarcinoma.
Insidious?
Insidious means undetectable at an early stage.
Insidious means treacherous.
Shall I continue?
Oh, by all means.
Good. In invasive epithelial carcinoma, the most effective treatment modality is a chemotherapeutic agent. We are developing an experimental combination of drugs designed for primary site ovarian with a target specificity of stage 3 and beyond administration. Am I going too fast?
No.
Good. You will be hospitalized as an inpatient for treatment each cycle. After the initial 8 cycles, you will have another battery of tests. The antineoplastic will inevitably affect some healthy cells, including those lining the gastrointestinal tract from the lips to the anus and the hair follicles. We will, of course, be relying on your resolve to withstand some of the more pernicious side effects. The tumor is spreading very quickly, and this treatment is very aggressive. So far, so good?
Yes.
Better not teach next semester.
Out of the question.
The first week of each cycle, you'll be hospitalized for chemotherapy. The next week, you may feel a little tired. The next 2 weeks will be fine, relatively.
8 months like that.
This treatment is the strongest thing we have to offer you. And as research, it'll make a significant contribution to our knowledge.
Knowledge. Yes.
Here is the informed consent form. Should you agree, you sign there at the bottom. Is there a family member you want me to explain this to?
Oh, that won't be necessary.
Good. The important thing is for you to take the full dose of chemotherapy. There may be times when you'll wish for a lesser dose due to the side effects, but we've got to go full force. Dr. Baring?
Yes.
You must be very tough. Do you think it could be very tough?
You needn't worry.
Good. Excellent.
I've asked more questions because I knew there was going to be a test. Hi, how are you feeling today?
Fine.
Great. That's just great. This is not my standard greeting, I assure you. I tend towards something a little more formal, a little less inquisitive, such as, say, hello. But it is the standard greeting here, so I just say fine. Of course, it is not very often that I do feel fine. I have been asked, how are you feeling today, while I was throwing up into a plastic wash basin. I have been asked, as I was emerging from a 4-hour operation with a tube in every orifice, how are you feeling today? I'm waiting for the moment when someone asks me this question and I am dead. I'm a little sorry I'll miss that. I have cancer, insidious cancer, with pernicious side effects. No, the treatment has pernicious side effects. I have stage 4 metastatic ovarian cancer. There is no stage 5. Oh, and I have to be very tough. Give me the full dose. The full dose. Every time. The attention was flattering for the first 5 minutes.
When did you first notice your present complaint?
This time now.
Yes.
Oh, well, about 4 months ago, I felt a pain in my stomach, in my abdomen, like a cramp, but not the same.
How did it feel?
Like a cramp.
But not the same.
Duller and stronger. I can't describe it.
What happened next?
Well, I don't know. I started noticing my body, little things. I would be teaching and feel a sharp pain.
What kind of pain?
Sharp. And sudden. Then it would go away. Or I would be tired, exhausted. I was working on a major project, the article on John Donne for the Oxford Encyclopedia of English Literature. It was a great honour, but I had a very strict deadline.
So would you say you were under stress?
It wasn't so much more stress than usual. I just couldn't withstand it this time. I don't know. So I went to see Dr. Chin, my gynaecologist, after I'd turned in the article, and explained all this. She examined me and sent me to Jefferson, the internist, who sent me to Kalikian because he thought I might have a tumour. One thing that can be said for an 8-month course of cancer treatment, it is highly educational. I am learning to suffer. Oh, God. Please. Steady. Steady. Oh, God. What's left? I haven't eaten in 2 days. What's left to puke? Forget that you are seeing the most interesting aspects of my tenure as an inpatient receiving experimental chemotherapy for advanced metastatic ovarian cancer. You cannot imagine how time can be so still. It hangs. It weighs. And yet there is so little of it. It goes so slowly. And yet it is so scarce. Grand rounds is what they call it. Action!
Dr. Berry?
Dr. Kalikian.
Professor Baring, how are you feeling today?
Fine.
Great, just great. Very late detection, stage just 4 upon admission. Hexamethylphosphacil with Vin platin to potentiate. Hex at 300 milligrams per meter squared, Vin at 100. Today is cycle 4, day 3. All cycles are at the full dose. Primary site is here, behind the left ovary. Metastases are suspected in the peritoneal cavity, mainly in this area here. Full lymphatic involvement. At the time of first look surgery, a significant part of the tumor was debulked, mainly in this area here. Left, right ovaries, fallopian tubes, uterus, all out. Evidence of primary site shrinkage. Shrinking in metastases has not been documented. Primary mass, frankly palpable in pelvic exam, all through here.
Excellent command of details. Okay. Problem areas with X and Vin?
Myelosuppression. First, of course, is myelosuppression, a lowering of blood cell counts. That goes without saying. With this combination of agents, nephrotoxicity will be next.
Anybody else? Side effects?
Nausea, vomiting.
Jason?
Routine.
Pain while urinating.
Routine.
Psychological depression.
No way.
Oh, anything else? Other complaints with Hex and Vin? Come on.
Mouth sores?
Not yet.
Skin rash?
No.
Why do we waste our time, Dr. Berry?
I do not know, Dr. Kalikian.
Use your eyes. Good grief. Hair loss.
Come on.
Doesn't count.
You can see that.
Jason?
Hair loss after first cycle of treatment.
That's better. Dr. Berry, full dose. Good. Excellent. Keep pushing the fluids. Jason, clinical.
Oh, right. Thank you, Professor Baring. You've been very cooperative.
Wasn't that grand? Full of subservience, hierarchies, gratuitous displays, sublimated rivalries. I feel completely at home. It is just like a graduate seminar. With one important difference. In grand rounds, they read me like a book. Once I did the teaching, now I am taught.
Temp 102, pulse 120, respiration 36.
Fever and neutropenia. It's a shake and bake. Blood culture and urine stat. Admitter. Prepare for reverse isolation. Start with acetaminophen. Vitals every 4 hours.
Jason, I think you need to talk to Kalikian about lowering the dose for the next cycle. It's too much for her like this.
Lower the dose. No way. She's tough. She can take it. Full dose. Wake me when the counts come from the lab.
I'm scared.
Of course you are.
I want to. I don't feel so sure of myself anymore.
And you used to feel sure, didn't you?
Yes. I used to feel sure.
Oh, baby, it's okay. It's all right. And it hurts. I know. It's all right. It's all right. It's okay. It's all right. Baby, it's okay. It's all right. Hey, Vivian, you want a popsicle?
Yes, please.
Okay. I'm gonna go get one. I'll be right back, okay?
The epithelial cells in my GI tract have been killed by the chemo. The cold popsicle feels good. It's something I can digest, and it helps keep me hydrated. For your information.
There you go.
Cute. Here.
Sure? Thanks.
Cute.
You know, when I was a kid, we used to get these from a truck. The man would come around and he'd ring his bell and we'd all go running over. And then we'd sit on the curb and eat our popsicles. It's pretty profound, huh?
Sounds nice.
Vivian, there's something we need to talk about. That you need to think about.
My cancer's not being cured, is it? They never expected it to be, did they?
Well, they thought the drugs would make the tumor get smaller. And it has. It's gotten a lot smaller. But the problem is it started in other places, too. And, I mean, they've learned a lot for their research, and it was the best thing they had to give you. It was the strongest drugs. It's just that there really isn't a good cure for what you have yet. For advanced ovarian. I'm sorry, they should have explained this to you.
I knew.
You did?
I read between the lines.
What you need to think about is your code status. What you want them to do if your heart stops beating. Well, you can be full code, which means that if your heart stops, we'll call a code blue, and the code team will come in and resuscitate you and take you to intensive care until you stabilize. Or you can be do not resuscitate, which means that if your heart stops, we'll just let it. You'll be DNR. And you can think about it. But I just wanted to present you with both choices before Kalikian and Jason come in and talk to you.
You don't agree about this?
They like to save lives. So anything's okay as long as the life continues. Doesn't matter if you're hooked up to 1 million machines. Kalikian's a great researcher, he is, and the fellows like Jason, they're really smart. And it's an honor for them to be working with him. They always want to know more things.
I always want to know more things. I'm a scholar. Or I was. When I had shoes. When I had eyebrows.
Okay, well, that's fine. I mean, you'll be full code.
No. Don't complicate the matter.
No, really, it's fine. It's up to you.
Just let it stop.
Really?
Yes.
So if your heart stops beating,
Just let it stop.
you sure?
Yes.
Okay. Okay, I'll get...
There aren't. I'm in terrible pain. Susie says... I need to begin aggressive pain management. If I'm going to start it. It... such a little word. I think in this case, it signifies being alive.
Okay. We've located Dr. Kalikian, and he's on his way here, and we'll get you some meds.
Oh, God, it's so painful. So painful, so much pain.
I know, just try and relax and clear your mind. We'll get you patient-controlled analgesic. It's a little pump with a little button, and you press it, and you decide how much medication you want. It's very simple, and it's all up to you. Okay.
Dr. Baring. Susie?
It's time for patient-controlled analgesic. The pain is killing her.
Dr. Baring, are you in pain?
I don't believe this.
I want a morphine drip.
But what about patient-controlled? She could be more alert.
Oh, no, yes. But in her case, no.
But I think she would really rather...
She's earned a rest. Morphine. 10 push now and start at 10 an hour. Dr. Baring, try to relax. We're going to help you through this. Don't worry. Dr. Baring. Excellent.
Professor Baring, how are you feeling today? 3 p.m. IV hydration totals. 2,000 in, 30 out. Oh, well, that's it. Kidney's gone. Professor Baring? Highly unresponsive. I see. Four, five, seven. Code blue, room 707. Code blue, room 707. Dr. Posner, Posner. Hurry up.
doing?
Goddamn code.
She's
Get over here.
DNR.
She's research.
She's no code. Jason, she's no code. Kalikian put the order in. You were right there. You saw it yourself. God, the code. 4575. Cancel code, room 707. Sue Monahan, primary nurse. No, Dr. Posner's. No.
I got it. I got it.
No.
Get out of the way.
The
Have the
patient
staff
is no
move out.
code. She's DNR.
Let's go. Let's move it.
The patient is DNR.
Okay, unit staff, clear.
Listen.
Back
She's,
away
do
from the
not
bed.
resuscitate.
Put the machine
patient
on, let's
is no-
go.
The patient
There's
is
no pulse.
code.
No pulse. Doctor,
The
get that
patient
board
is no
under. Let's
code.
roll it. Hey, get the board
Out
under.
the way. Stop it.
Charging.
Please, listen
Give her
to
1
me.
milligram of
The
epi.
orders. Get it back.
Keep it going. By call back. Doing
Do
this.
not resuscitate.
Stop.
Do
By
not
call.
resuscitate.
She's no code. Move out the way. Go.
Stop this.
Still no reading. No pulse. Hey,
Clear.
Hey,
Leave her
listen.
alone.
I made a mistake.
No code. The patient is no code.
Who the hell are you?
I'm Sue Monahan. I'm the primary nurse.
Let me see the goddamn chart.
The patient is no code. Just get away from her.
Do not resuscitate. Kalikian. The order was put in yesterday. It's a doctor screw up.
What is he, a resident?
Got us up here on a DNR.
Called a code and a no code.